It's a structure, so the limitation is, so we can't really have this entire volume very solid. You want to have a lattice because for the light weighting, otherwise it's going to be very heavy. And also you need to have some features which allows this device to be attached to the bone very well, and it gives a very good fixation. So again, this case was designed. The image of the second row, it shows that the anatomical model printed in plastic, along with the implant printed in metal, and the implant was placed, and patient is doing very well. This is an example of a multiple level spine construct. So typically for the spines, so you have to put 1 or 2 levels or 3 levels of fixation. So however, if patient's anatomy is very complex, and there is a risk of failure if they use a standard product, so we can design something like this, which is a multiple level fixation. So what makes this device very cool is, so the engineer put a rod at the back of this device. As you can see, that solid rod. So this is good for attachment to the screws and other fixation construct. So this is an example of the humerus bone in the shoulder. So again, person had fracture in the shoulder area, and it was also a tumor, so they had to basically take that volume and use a CT and MRI and reconstruct that with a truss structure, which is done by Forward Medical again, and that's another example. So some very rare cases, such as this one. So when it comes to bone fixation, one of the biggest challenges is the stability of the construct. And so for implants, designed for the rib cage area, the front of the chest, the biggest problem is the person has to do like in breathing all the time, and that chest moves in and out. So it's just the bones are moving all the time. So your goal is just to get the fixation and osteointegration as soon as possible. So that's where the 3D printed implant comes into the play, because you can design a structure which has a lattice to the front, and it has some holes in the solids for interaction with the bone, and the bone fills that space pretty quickly and gives you a very good construct. And so let's do a last 2 examples. So one of the other advantages of the PSI system is it can be designed to work or match with other existing technology. If the surgical procedure involves replacement of the joint, like a total knee replacement, what can we do here? So we can basically get the total knee implant component, the one at the far right, from a supplier like a Stryker, Medtronic, or some other companies, and then design the bone fixation parts such that it attaches well to the total joint replacement. It gives a very good, results. Again, the goal is to have that space filled with bone ASAP. And this one is another application which is also very common. This is for the talus bone. So what makes this example different from anything else which I showed you is the material. So anything I showed in the previous slide was made of titanium. This one is a 3D printed cobalt chromium, so which is designed by a supplier. And the reason that we use cobalt chromium is because it's very important to have a very polished surface to avoid damaging the tissues and the cartilage at the joint, at the ankle joint. You can get, I've seen, in a previous conference, I've seen, some examples of titanium implants which had some polished surfaces, but I don't think it comes anywhere close to what you get from cobalt chromium. So that's another good applications. So with that in mind and all the information which I went over, so if we want to basically look at this 3D printed technology from challenges perspective and regulatory approval, so while they have a lot of benefits, they come with our own set of challenges. Unlike the traditional machined implants, which have been around for many years, so these devices have some limitation as far as the test guidelines. The test guidelines which FDA used for approval based on ASTM standards are not new. It's been around for many years. They have not been refreshed. Obviously, if you have a big chunk of metal and use that for testing, and you have a 3D printed open lattice structure, the lattice is not going to be as strong. It doesn't hold up to the same level of the load. So that's a challenge. Those standards need to be updated. So I was on a call with the FDA 2 weeks ago. We discussed that. So they were basically getting this information from the suppliers. So then there is the variability in the process and deviations. So you always have an implant which is slightly different from what you design in the computer. There is a build orientation which comes to the play, so there is variation to the process, and that basically brings up the question that is the printed implant a worst case scenario compared to the design part? If yes, so you have to do additional testing. You cannot just use the computational modeling. And then, so if these lattices are completely random and come in different shapes and types, so now you have 200 sizes and configuration, let's say for a lateral cage. And you have to test one of them. You cannot test all of them. It's going to take forever. So you have to do a worst case assessment. How can you say this size, the large footprint, like 6 degrees with this length is the worst case scenario for FDA 10? So that's going to be a little bit of a challenge there. And the impact of post-printing process, heat treatment, heaping, and so on. So if you have to do this, so there has been a lot of conversation in the industry. Can we skip some of the heat treatment process? The problem is it takes anywhere between 7 to 10 days, especially for the PSI devices, so that's a long time. So can we skip that? Can we modify the heat treatment process? And last one is, according to the FDA guidelines for 510K approval, we always want to compare this against another device and show this is equal or better. So what is the predicate device that they're going to use? So it's becoming very challenging to find the predicate device for some of the emerging technologies, such as, for example, ankle products, the devices which are new and have not been around for many years. So as far as where we are going or anticipate to go in the future is a point-of-care solution. So, I mean, right now it's a corporate, there is a supplier, and there is a healthcare facility, 3 different locations, at least 3 different locations. So sometimes you have 4 or 5, depending on whether the post-processing is done elsewhere. So can we bring some of these process in-house at a hospital or a healthcare facility? So that starts with having a software which can automate the segmentation, especially for the patient devices. You can plug in the images into the software. It will automatically extract the volume. And then you have a software, design software, which can optimize your structure, takes into account the bone density, the quality of the bone of the person, and design a structure to match that. And then we have the manufacturing process. Can we bring some of these machines to the hospital? Obviously, 3D printing itself is not as much of challenging as some of the other post-treatment process. So you don't want to bring the heaping to the hospital. That's going to be the recipe for a catastrophe if things go out of the control. And then we have the surgical automation tools such as robotics, and we use that along with the instruments to have a very good procedure. So the question is it possible that we have to do a same-day surgery if we bring everything in-house to the hospital and we have all the resources? So that's a question which has to be answered. We don't know. There is a lot of things involved as far as the hospital, the insurance companies, the regulatory side, and the suppliers. So that was my talk. I hope that you enjoyed this presentation, and I'll be happy to answer any questions, if any.
Ali, thank you so much for your presentation. We have time for one question, and I would like to choose the following one. How long is it painful for the patient?
Well, that's a very good question, but it's heavily depends on the surgical procedure. So for the spine cases, I know that the surgeons in private practice, they do surgery in 45 minutes. It's faster than filling a tooth. But when it comes to cases that hemi-pelvectomy implant, so that took about a day. Mm-hmm. And so the longer the operation, the more are the complications. Mm-hmm. So a lot of times patients with those have to come back several times, have infection, it's a big problem, and many other things. But the goal is just to have everything gone in 3 months.
Ali, thank you again.
Sure.